Welcome to Wysdom Radio. I'm Dr. Rusty Hofmann, professor of interventional radiology at Stanford, bringing you a direct line to critical research and interventional updates. Powered by AI, curated by experts. Let's get started. How are you doing? Rusty Hofmann, founder of Wysdom and professor of interventional radiology at Stanford. Tonight we're going to talk about what to do when you're on call. All right, so it's usually, at least at Stanford, we only come in the middle of the night for two reasons: loss of life or loss of limb. Otherwise, we push things in the morning when we have the entire team in the hospitals well staffed in case we have an emergency during the case. All right, so I've taken call for 25 years at many different institutions. And when I get called in the middle of the night, the most important thing to first start off with is, hey, Rusty, we have a GI bleeder in the emergency room that I think we're gonna need to do, so that I already know that your assessment is we need to come in. The next thing I want to hear is what the age and problem and the vital signs actually. 55-year-old male with hematemesis, his blood pressure is 90/60, his pulse is 120, and his O2 sat is 95%. And so then I know how actually unstable the patient is. Also, important things to tell the attending are how much blood product the patient has received and over what time period, what type of pressor support are they on, 1, 2, or 3 pressors, and are they maxed out or just a little bit of pressor support? And importantly, and often overlooked, is the patient on a beta blocker? A beta blocker prevents the compensatory tachycardia that occurs with hypotension. And you can say, oh, wow, the blood pressure is 100/60 and the heart rate is 70. You're like, oh, the patient's probably stable. But really, because they're blocked, in reality, they would probably be tachycardic at like 120. And so it's important to look through the chart and also add that to the presentation. And then what I like to then hear is like, all right, so CT scan shows that he has varices and open portal vein. I think we're going to need to do a TIPS. I'll get into actually a more detailed presentation about how to actually give a proper case presentation. But when you're calling in the middle of the night for an emergency procedure, it's really important to lead with the problem at hand, if you think it's going to need to be done, and actually the vital signs of the patient, because that gets me kind of engaged. Every attending is different, but this is the way I like it. One other common question is, what are my parameters for being worried or doing an angiogram? And I have basically two. One is the rule of 100. If the patient's pulse is above 100 or blood pressure is below 100, I'm worried that they could be actively bleeding. And then number two, I find almost universally is a positive predictor of seeing a positive angiogram or active extravasation on an angiogram is that the patient is actively being transfused when I come into the room to do the case. Then the next thing is, once you've agreed to do a procedure, how do you remember at 2 a.m. all the different things you need to make sure that you get done as a resident or fellow or APP for the case to be done? So I have this mnemonic that is basically 6 C's. The first C is consent. Got to get consent. The second C is Coags. The third C is creatinine. The fourth C is contrast allergy, because typically you're giving contrast. The fifth C is like, is there a contraindication? I'm going to be giving this guy TPA. Do they have have they had recent surgery, recent trauma, something in their brain? And then the sixth and most important, especially in the middle of the night, can this patient be still? So does that mean the patient needs anesthesia? So those are the 6 C's that I go through in my head at 3 o'clock in the morning, 2 o'clock in the morning when I'm talking to my resident to make sure that we have all our ducks in a row. All right, good luck. This is Dr. Rusty Hofmann, and that's a wrap for Wysdom Radio. Download the Wysdom app by searching for Medical Wysdom, spelled WYSDOM, or visit medicalwisdom.ai for rapid-fire videos, podcasts, and community insights. And remember, knowledge is the best medicine.